Hi everyone, and welcome to this short webinar on an introduction to quality improvement research. My name is Dr. Becky Appleton. I'm a research fellow at UCL. I'm also working with Health Education England on this Thinking Together project. So hopefully I'll see you at some point at some of the in-person events. So my PhD was about understanding why young people fall through the gap between child and adult mental health services and the associated costs for the young person, their family and society. I've also done some research to explore the ways in which GPs could help improve continuity of care for young people during their transition from child and adolescent mental health services. And I'll use some of the examples from this research over the course of this webinar. And my role as part of the Thinking Together project is to offer academic support to you all during your quality improvement projects. And here is just one definition of quality improvement, which states that quality improvement aims to make a difference to patients by improving safety, effectiveness, and experience of care by using understanding of our complex healthcare environment, applying a systematic approach, and designing, testing, and implementing changes using real-time measurement for improvement. And it's that measurement that's really key in a quality improvement project. And you can think about quality improvement as an extended audit. So whereas an audit just measures what's going on in a service at a particular time point, quality improvement takes that further and implements some sort of change before running the measurements again. And that way you can really see the impact of any changes you've made. Quality improvement is also different from research. I'm sure you've heard that statistic that it takes around 17 years on average for the findings from research studies to become embedded in clinical practice. Quality improvement is a way of making changes which occur a lot more quickly. There are several models of quality improvement which are often used when conducting quality improvement projects. Perhaps one of the most commonly used is the planning, doing, studying and acting cycles, or PDSA for short. These cycles are linked with three key questions. So firstly, what are we trying to accomplish in our quality improvement projects? Secondly, how will we know that a change is an improvement? So this is linked to the point I made on an earlier slide about the importance of measuring. So measuring before and after you've made the quality improvement change in order to know that that change has resulted in some form of improvement. And thirdly, what changes can we make that will result in improvement in a particular service? It is likely that you'll do several of these PDSA cycles over the course of your quality improvement work. An alternative model is LEAN, which is an approach which emphasises the patient's central position to all activities and aims to eliminate or reduce any activities that do not add value to the patient. So this is really putting the patient at the centre of your quality improvement project. There are 5 steps in this approach. Firstly, defining what is value adding to patients. So how could care be improved from a patient perspective? Secondly, mapping value streams, which are pathways that deliver care. Number 3, making value streams flow by removing any waste, delay or duplication. 4, allowing patients to pull value towards them so that care meets their needs. And 5, pursuing perfection as an ongoing goal. Here's just an overview of some of the common technology used around quality improvement and research, just to explain some of the differences, as I know it can get quite confusing. So quality improvement uses a range of tools to make improvements to services, and then the impact of these changes are measured. So as I said before, this is what makes quality improvement distinct from something like an audit, which just takes one measurement. Service evaluations are designed to answer the question, what standard does this service achieve? And service evaluations are mainly used to see if a service is meeting its goals and whether it's operating effectively. In contrast, research is designed and conducted in order to generate new knowledge. So research projects aim to answer specific research questions and advance knowledge in a particular field. All research projects require ethics approval, first from your study sponsor and then from the NHS. And this is if you're conducting research in an NHS setting. This process can take quite a long time, so if you're ever planning a research project, then make sure you take this time period into consideration. However, when you're doing your quality improvement projects, you want to make sure that what you're doing is actually quality improvement work and not research. So I've linked something called the HRA decision tool from the Health Research Authority in the resources at the end of this presentation. And this is a flowchart which can help identify whether any ideas for your projects count as research or quality improvement. However, just a note to say that even though you're doing quality improvement rather than a research project, you will still need to take ethical considerations into account. And here is a screenshot from the HRA decision tool. And this is one of the questions that can help to categorize your project as research or not. So for example, if you were to answer yes to this question, are the participants in your study randomized to different groups? Then that would imply that you're planning a research project over a quality improvement project or a service evaluation. I'll now outline some of the qualitative methods that you might consider using as part of your quality improvement projects. So here are probably the three most common examples of qualitative methods. Firstly, interviews, which can be structured, which is where you have quite a rigid interview topic guide. Semi-structured, where you have a topic guide, but there is also some flexibility to allow you to ask follow-up questions or for the participant to guide more of the interview content. And finally, narrative, where you ask the participant to tell you about something which happened over a certain period of time. Secondly, there's focus groups, which is more of a group style of interview where you ask participants questions and they can feed off each other. And finally, qualitative surveys, which is where you add open-ended questions to a survey, allowing participants to write their responses. These responses can then be analysed and treated the same way as other forms of qualitative data. When thinking about analysing qualitative data, the most commonly used methods are thematic analysis or content analysis. Thematic analysis is more of a true qualitative analysis method, so this allows you to generate themes from your data through a process of coding and categorising your data into certain themes. In contrast, content analysis is a way of categorising qualitative data, and this can be qualitative, so you focus on interpreting the data, or quantitative, so you can count frequencies within your data. An example of this would be counting how many times a certain topic is mentioned by your participants. If you have quite a lot of qualitative data, I really recommend using a certain kind of software, such as NVivo, as this can help keep track and map your codes to your themes, for example. And here is an example of some qualitative coding that I did as part of my PhD research. So you can see here, this is an excerpt from the interview transcript. And I've assigned 5 different codes to different sections depending on what the focus of that section is. So for example, you can see in the first highlighted yellow section, I coded that feeling abandoned because that's the meaning behind that bit of the transcript. Once you've done this for all of your research, you then combine these codes together into categories and then combine those categories into themes to generate your thematic analysis. And here are 2 of the themes that derived from that research. So when I was looking at the reasons for falling through the gap between child and adult mental health services, I found 2 major themes. Firstly, systemic barriers to continuity of care, which was divided into 3 sub-themes. Firstly, not being ill enough for adult mental health services, inadequate service provision after leaving child and adolescent mental health services, and finally, a lack of joined-up care between services. The second overarching theme was problems with the quality of care received, and this also had 3 sub-themes. So firstly, not receiving appropriate care when in a mental health service. Secondly, not being prepared for care at child and adolescent mental health services to end. And finally, being put off accessing further care. And I've added the link to this paper in case you'd like to find out any more about this research. I'll now move on to talk about some quantitative methods you might want to use as part of your quality improvement projects. When thinking about quantitative methods that you might want to use as part of your quality improvement projects, one commonly used method of data collection is a survey. and this can be done with pre and post measures, where you take a survey before and after you've implemented your quality improvement change. Surveys can be done to explore the effect of improvement, or also the views of improvement, and this could be views of staff or service users. Rather than collecting your own data, you could also use data which is routinely collected in the service already and analyse data that was collected pre your quality improvement work, and then compare that with data which was collected afterwards. When it comes to quantitative data analysis, you probably don't need to do anything too complicated for a quality improvement project. It will be enough to present descriptive statistics, so the means or the range of data, etc. And it's also really useful to present visual representations of your data and findings. If you do need to do any type of quantitative data analysis, then I'd really recommend using some kind of software like SPSS or Stata, and Excel is great for making simple graphics. You could also choose to combine qualitative and quantitative measures and use mixed methods for your quality improvement project. In research, mixed methods is an approach which collects both qualitative and quantitative data in the same study and integrates these data at some stage of the research process. This allows you to create something where the final product is worth more than the sum of its parts, and this is achieved through integrating the findings to allow you to generate new insights from the data. One way you could use mixed methods in your quality improvement projects could be to conduct a mixed methods survey, where you have closed questions to capture quantitative data, but then also some more open questions to allow for qualitative responses. I'll now talk through some examples of potential quality improvement projects. So when you're thinking about the quality improvement work you'd like to conduct, it might help to think about the focus of this programme, which is to consider how to improve patient experience in terms of individual approaches to care, and also in terms of taking a systems view, including how we communicate and collaborate with colleagues. And there are 6 different themes within this Health Education England Enhancing Generalist Skills programme: system working, multimorbidity, person-centred practice, social justice, population health, and sustainability. And you might want to use any or a combination of these as a starting point for your ideas for your quality improvement project. And here are a few examples of potential quality improvement projects. So firstly, you could look at investigating inequalities in access to a particular service through looking at the types of patients who do or do not access it. Another idea is gathering patient feedback from people with English as a second language. So how can existing questionnaires be modified to make sure they're accessible to everybody? Another idea is to look at what provision is in place for children and young people to support them in the transition from paediatric to adult ITU. And finally, another idea would be to review the notes of 30 patients recently admitted as psychiatry inpatients. How many of these had coexisting chronic physical comorbidities? And did these comorbidities have any impact on their mental health or vice versa? You'll probably be able to think of other ideas yourselves, but hopefully these are a useful starting point. And finally, I'll move on to give some tips for successful quality improvement. When choosing a focus for your project, it might be useful to think about the following. So firstly, think about your local context. Is there anything you think works well, or perhaps doesn't work so well in your current role? You could also look at existing literature. So what research has already been done to try and address this problem? This might help you see whether there are any similar projects which have been undertaken either at a local or national level. You can also be creative here. So if you do find a model or a project which exists perhaps in a different setting, you could then adapt this existing model to fit your current context. And here are a few more tips. So firstly, it's really important to pick a small, achievable project. You only have to make a small change for your quality improvement project to work, And think back to the PDSA cycles, where you make several changes over time and measure the impact of each one before starting the next cycle in your quality improvement work. It's also really useful to make sure you have a clear research question or aim, for example, using the SMART framework, making them specific, measurable, achievable, relevant, and timely. It's really important to be realistic and make sure that you can make the changes you want within the available resources and the time frame that's available to you. And finally, make sure to ask for support if needed. And here are just some things to avoid in your quality improvement project. So firstly, avoid not measuring change. You really want to be able to show the impacts of your quality improvement, so make sure you compare any figures that you've got from before or after you've done the quality improvement work. Also, don't try and do it all on your own. There might be people in your clinical environment with expertise who can help you. Are there any patients who can help you with design of a questionnaire or help to create the right change? Also, don't forget about sustainability. So what will happen to your quality improvement project if you rotate out of that job? Can it be something that's sustainable for others to take on after you? And finally, make sure you don't take on too much or agree to take on somebody else's project if it's not in your interest. If you do something you enjoy, it's much more likely to be successful. And when you're thinking about how to make an impact from your quality improvement work, the field of implementation science could be helpful, as this provides frameworks which can be used to improve implementation of an intervention, so in your case, implementation of a quality improvement project. The CFIR, or Consolidated Framework of Implementation Research, is one of these frameworks which has 5 domains broken up into internal setting, external setting, process, intervention characteristics, and characteristics of individuals involved. And this can help make sure that any implementation is tailored to the local context. For example, can make sure that you can overcome any specific barriers. And here are just a few useful resources on quality improvement, which might be useful for you to read through before starting your quality improvement work. And here are a few resources on research methods. The first link is the HRA decision tool, which I mentioned earlier on in this presentation. And that's everything. So thank you very much for listening. If you have any further questions, then please feel free to drop me an email. My email address is shown on the screen now. And I'll also be running some online drop-in sessions over the course of the Thinking Together project. These will be advertised to you over email, so please feel free to attend if you'd like to ask me any other questions about your quality improvement project. Thank you.